Your penis could reveal a serious health problem years before you feel sick. Changes in your erections may be an early warning sign of poor circulation, hormonal problems, nerve dysfunction, chronic stress, or even cardiovascular disease. Some methods men use to improve performance or increase size can cause injuries, scarring, erectile dysfunction, and in extreme cases, permanent damage. If you care about your penis, your sexual function, or your future fertility, watch this video until the end. Today I'll explain 10 things you should never do to your penis, and number 10 may change the way you think about erections.
I'm Dr. Nay. Part of my work involves helping men protect their urinary, reproductive, and sexual health. Many men pay attention to penile health only after something goes wrong. They ignore pain, experiment with dangerous enlargement techniques, use homemade devices, or delay seeing a doctor because they feel embarrassed. Penile health can tell you a lot about the rest of your body. This video is for general health education and does not replace a medical exam or personalized advice. If you find this helpful, subscribe and turn on notifications.
Don't ignore changes in your penis. Erections are connected to more than sex. Healthy erections require blood vessels, nerves, hormones, brain function, and a relaxed psychological state. Changes in erectile function can reflect problems elsewhere. Research links erectile dysfunction with a higher risk of future cardiovascular events. That doesn't mean every man with ED will have heart disease, but new or persistent erectile problems shouldn't be dismissed as just aging. They may relate to poor circulation, high blood pressure, diabetes, high cholesterol, hormonal problems, nerve damage, medication side effects, smoking, substance use, chronic stress, anxiety, or depression. If something changes and stays different, pay attention. Your penis may be trying to tell you something. Don't try dangerous DIY treatments. There is no homemade liquid, oil, food mixture, stretching ritual, or magical ingredient that safely makes your penis dramatically longer or thicker overnight. Pouring vinegar, oils, or chemicals on your penis can cause irritation, chemical burns, swelling, infection, or skin damage. One common risky practice is jelqing, which involves repeatedly squeezing and stretching the penis. Excessive pressure can create microscopic injuries to tissues and blood vessels, leading to pain, bruising, swelling, scar tissue, curvature, reduced sensitivity, blood vessel damage, and erectile dysfunction. Many men perform these techniques too aggressively, turning a questionable method into serious injury. Also, never use homemade constriction rings. Metal nuts, bottle openings, and plastic rings can trap the penis when it swells, cutting off circulation and causing permanent damage. There are emergency cases where doctors or firefighters had to remove metal objects. Use only medically designed constriction bands when appropriate, and follow instructions carefully. Keep it clean, but don't overclean it. Good hygiene is essential, especially with a foreskin. Gently retract the foreskin, wash underneath with warm water and a mild unscented cleanser, dry carefully, and return the foreskin. Without cleaning, smegma can build up and cause irritation, odor, inflammation, and infections like balanitis, which causes redness, swelling, pain, itching, discharge, odor, and difficulty retracting the foreskin. But avoid aggressive scrubbing, strong scented soaps, harsh chemicals, or excessive washing. These can remove natural oils, damage the skin barrier, and cause dryness, irritation, and tiny tears. If you cannot retract your foreskin, see a doctor. Forcing it can create tears, bleeding, scarring, or an emergency if the foreskin becomes trapped. Treatments range from steroid creams and guided stretching to minor procedures or circumcision in selected cases. Inspecting the area matters because although penile cancer is rare, lesions can develop under a non-retractable foreskin. Don't ignore pain, blood, sores, or other warning signs. If you notice pain, discharge, swelling, sores, ulcers, bleeding, lumps, color changes, or difficulty urinating, see a healthcare professional. Causes include sexually transmitted infections, urinary tract infections, balanitis, skin irritation, allergic reactions, trauma, stones, structural problems, dermatological conditions, or rarely cancer. Blood in the urine should always be taken seriously. A sore or ulcer that persists needs examination. I know it can feel embarrassing to show your genitals to a doctor, but protecting your health is more important than temporary embarrassment. Healthcare professionals see these problems regularly. If you feel judged, find another qualified clinician. Early treatment is usually less extensive than treatment after disease progression. Don't have unsafe or uncontrolled sex. Safe sex is not boring. It lets you relax and be more present. Use condoms correctly and find a condom that fits and feels comfortable. A condom that is too tight can tear. One that is too loose can slip. Use a new condom each time, check expiration dates, and avoid oil-based lubricants with latex condoms. Stay in control during vigorous intercourse. Sudden bending of an erect penis can cause a penile fracture, a tear in the tunica albuginea. It is a surgical emergency. Typical signs include a popping sound, immediate severe pain, rapid loss of erection, swelling, bruising, and a bent appearance. Go to the emergency department immediately. Early surgical repair offers a better chance of preserving function. Use enough lubrication to reduce friction and make sex safer and more comfortable. Reduced natural lubrication can result from hormones, medications, stress, dehydration, or medical conditions. Communicate with your partner and use appropriate lubricant. Don't overheat your testicles. Healthy sperm production needs a temperature slightly lower than the body's core. Repeated or prolonged exposure to excessive heat, like long sessions in hot tubs, saunas, steam rooms, or very hot baths, may temporarily reduce sperm production and affect sperm quality. Occasional heat exposure won't make you infertile, but repeated prolonged exposure can matter, especially if you already have reduced sperm quality or are trying to conceive. Avoid placing a hot laptop over your groin for long periods. Evidence about phones and fertility is still developing, so avoid exaggerated claims, but minimizing unnecessary prolonged heat exposure is reasonable. If you have fertility concerns, see a doctor or fertility specialist. Don't be too aggressive during masturbation. Masturbation is normal, but repeatedly using extreme pressure, excessive speed, aggressive bending, or a grip much stronger than a partner could comfortably reproduce can cause problems. The so-called death grip can desensitize you to ordinary stimulation, making it harder to reach orgasm with a partner and potentially causing performance anxiety or difficulty maintaining arousal. Aggressive techniques can also cause pain, bruising, skin damage, or contribute to Peyronie's disease from repeated trauma. If you notice reduced sensitivity or difficulty during partnered sex, consider moderating your technique and seeking guidance if needed. Don't ignore persistent curvature or lumps. A certain degree of curvature can be normal, but a new or worsening bend, especially with pain or a palpable lump, may indicate Peyronie's disease or scar tissue in the tunica albuginea. Peyronie's can cause painful erections, erectile dysfunction, and significant curvature that interferes with sex. Treatments range from observation for mild cases to medical injections, shockwave therapy, traction devices under medical supervision, or surgery in severe cases. Early evaluation improves treatment options and outcomes. Don't delay professional help after trauma. If your penis is cut, severely bruised, crushed, trapped, or shows signs of fracture, seek immediate medical attention. Timely care can prevent long-term complications like chronic pain, curvature, numbness, and erectile dysfunction. Do not try to manage severe injuries at home. Don't think of erections only as sexual. Erections are a window into your vascular, neurological, hormonal, and psychological health. Changes can be an early sign of cardiovascular disease, diabetes, hormonal imbalance, or neurological problems. If you notice new or persistent erectile difficulties, especially if accompanied by other symptoms like chest pain, shortness of breath, or unexplained fatigue, see a healthcare professional. Addressing underlying health problems early improves outcomes for both sexual function and overall health. If you care about your penis, protect it by avoiding risky DIY methods, practicing safe sex, keeping hygiene simple and gentle, watching for warning signs, moderating technique during masturbation, avoiding repeated heat to the testicles, and getting timely medical help for injuries or persistent changes. Your sexual health is part of your general health. This information is for general education and does not replace a medical exam. If you experience any concerning symptoms, contact a qualified healthcare professional. Thank you for watching. If you found this useful, subscribe and turn on notifications for more practical men's health information.